Hello, everyone, and welcome to the PHLCVB's webinar event focused on vaccines. As most of you know, the PHLCVB has long been a leader in utilizing the amazing health professionals and resources of our region to help attract meetings and conventions to our destination. Our PHL Life Sciences Division was started over 30 years ago for that sole purpose and is today comprised of 50 advisory board members from the health and care industry, and its executive director is Bonnie Grant, who's done an amazing job over the past 12 years and is on this call as well. When COVID-19 was progressing in the spring, Bonnie established a 20-member subcommittee as a resource to help the PHLCVB relay information and share resources with our clients, members, and local partners. When we realized there was an enormous amount of information in the public and much of it was hard to decipher, we felt the need to partner with someone in the local healthcare industry that could serve as an external voice. To support this effort, the PHLCVB has partnered with Dr. David Nash, Dean Emeritus of the Jefferson College of Population Health, as the PHLCVB's Chief Health Advisor. An acclaimed national leader in population health, Dr. Nash is an endowed chair professor of health policy at the Jefferson College of Population Health, the first of its kind in the country, where he served for more than a decade as the founding dean, culminating in a 30-year tenure. A board-certified internist who holds both an MD and MBA, Dr. Nash is internationally recognized for his work in public accountability for outcomes, physician leadership development, and quality of care improvement. More recently, he has been lauded for his thought leadership surrounding the COVID-19 pandemic. He received a BA in economics from Vassar College, his MD from the University of Rochester School of Medicine and Dentistry, and an MBA in health administration from the Wharton School at the University of Pennsylvania. Dr. Nash lives in Ardmore, just outside of Philadelphia, and has been married to his wife of 40 years, Dr. Esther Nash, and they have 3 grown children. Our other guest today is Dr. Leonard Friedland, Vice President and Director of Scientific Affairs and Public Health for GSK Vaccines. He's a pediatrician and research scientist who is passionate about vaccines. He spends his days helping people understand the science of vaccines and complex ideas about how vaccines help to improve public health and the lives of patients. Following a rewarding academic career in teaching and patient care, he joined GSK in 2003 to focus his efforts on vaccination and public health. At GSK, Dr. Friedland is involved in the development of vaccines for use in children, adolescents, adults, the elderly, and pregnancy, including vaccines for the prevention of flu, meningitis, whooping cough, rotavirus, hepatitis, measles, RSV, and shingles. He is privileged to be GSK's medical and public health representative and spokesperson for U.S. vaccine topics at the CDC, other public health venues, congresses, and media outlets. Prior to his work at GSK, Dr. Friedland was a division chief, pediatric emergency medicine at Temple University's School of Medicine. He studied medicine at Mount Sinai School of Medicine in New York, and he's published more than 50 peer-reviewed articles during his career and many book chapters on healthcare and vaccination topics. Dr. Friedland has been married to his wife, Dina, for 33 years, and they have 2 grown children. So as you can see, we've got some amazing brain power with us today for the next hour to help shed light and break down the complexity surrounding the vaccines. Before we get started, I need to state that this webinar with Drs. Nash and Friedland is meant to serve as an informative discussion based on their knowledge and experience. As always, please refer to the guidance offered to you by your organization, the CDC, and state and local authorities. Please use today's discussion as a thought starter while planning your events over the next few years. Also, I want everyone to know that the chat feature isn't available, but you can add any questions as you go along into the Q&A section, and we'll do the best to get them incorporated. First off, welcome, gentlemen. So happy to have you with us.
Great to be here. Thanks again.
Thank you very much.
Well, we've had a number of customers submit some great questions over the past week, and we've worked them really into 3 categories: vaccine safety, vaccine distribution, and the impact it'll have on meetings and the travel industry. So we'll start with vaccine safety. As I think we all know, if you've been reading the paper, there's a lot of talk and concern about Americans not wanting to get vaccinated, a good percent of their population. Knowing the vaccine trials usually take years, not months, and with multiple vaccines moving through the trial so quickly, how do you stress to your friends and family or your counterparts that this vaccine will be safe to take? And I'll start with you, Dr. Friedland.
That's a great question and a great place to start, because patient safety is of utmost importance for anything that we do. I am absolutely reassured that no shortcuts were taken around patient safety with these vaccines. The two vaccines, the one that's available right now under emergency use authorization, and the second one that's going to be coming likely within the next few days, each enrolled more than 30,000 patients in their clinical trials. They've been following these patients for many months. The data have been looked at backwards and forwards by independent review boards, independent committees of the FDA, and all of the documents are available for the public. I've read them myself, literally every page of these documents. I am convinced that the patient safety is there. These vaccines are safe and the benefits outweigh the risk. Safety will continue to be followed, Kevin, but shortcuts have not been taken. These vaccines are safe for our society and will offer tremendous benefit.
Dr. Nash, I know you've got a personal story with the vaccine that happened just this week. Talk to us about your thoughts on that.
Sure. So first, I want to say how great to have Len to help me, and special thanks to Bonnie Grant and the entire team, and to all of our listeners today. It's a real privilege to continue to be involved with the Convention and Visitors Bureau. Well, Len's really wonderful to have read the details. I have a similar view, and I can't wait to get the vaccine when it's available to people like me. My junior attending physician daughter got her vaccine yesterday. Our whole family celebrated because she's in category 1A on the front lines. But I do think for all the leaders on the phone and on the conference today, it is important, Kevin, that we not talk down to people who are against the vaccine. We need to understand where they're coming from. If you go online, sadly, there are books and conferences all promoted by the anti-vaccine movement in the country. You cannot deny the size and scope of this movement. So my advice is to engage with these people. And look, nothing in medicine is 100% at any time. So you got to be upfront about that. However, personally, I can't wait to take the vaccine. My physician wife can't wait to take it. Our daughter got it yesterday. And I know I speak for all 35,000 people who make up Jefferson Health System, our 14 hospitals in Philadelphia. We can't wait to get the appropriate vaccine for each of us. So for the leaders who are listening in today, I think they have a very important role to play to set a good role model and to get vaccinated, but to recognize that not everybody feels the same way. And I hope we'll have time to get into some of the reasons why folks are reluctant to get vaccinated.
And Kevin, just to add to what David's saying, is a vaccine research scientist who's developed more than 16 vaccines in the course of my career. I can tell you that everybody involved in this development process is incredibly, incredibly proud of the work that's been taking place. The data are outstanding. The benefits will be incredible, and the vaccines are safe for our society. And I personally also cannot wait to receive the vaccine for myself and my family. And science has really led us to a new place now to begin to tackle this, and rest assured, but now we need to lead by example and make sure that everybody understands how important it is, and that this is going to really make a tremendous difference and a safe way of doing it as well.
Great.
What are you hearing about the immediate side effects and the impact that might have, and what we might need to do based on that?
Yeah, so importantly, and it's critically important that everybody understands sort of the journey that's going to happen when they receive vaccination. The data show thus far with the two vaccines that we're speaking about, the ones from Pfizer and soon the one from Moderna, people will experience some injection site pain, redness, swelling, maybe some headache, fatigue, just not feeling well, short-lived, a little bit more after dose 2, after dose 1. Both vaccines are 2-dose vaccines, short-lived. And so it's important to know about that. Healthcare providers will be telling the people who receive the vaccines, telling us what to expect, and that's really important. We also need to be observed after vaccination. There are some reports for people who have a particular history of allergies that there could be some allergic type reactions, and so it's recommended that people be observed for at least 15 minutes after vaccination. And if you have a history of allergies, to be observed for 30 minutes. And that should be done in a place that could respond if there's an allergic reaction with oxygen, et cetera. So we need to know about this. Healthcare providers, public health departments, clinics that will be vaccinating will be telling everybody about this. And as long as we know what to expect, then we need to do that. I think as business leaders, of people leading groups with people that you can explain to what's happening, let people know that when they get vaccination, if they need to take a day off, if they need to stay home the next day after that vaccination, they should go ahead and do that because they may not feel so well. In general, this is what we expect after a vaccine. The vaccines are making our immune systems activate so that we can have a defense system later on if we ever see this virus, and that immune activation is what we're seeing with some fever, pain, redness. So expect this to happen and give your employees the opportunity to stay at home if they need to for a day until they start to feel better. But it's short-lived, and we'll continue to follow this. But everything is pointing very typical for what we'd expect for vaccination.
Hey, Kevin, I would add to Len's great answer, that immune activation, that's really important. So that headache, that arm ache, that feeling not so good, that's good. That's exactly what we want to see. That means your immune engine is working. And so the folks who got the placebo during the trials, they didn't have those side effects. So it's really important that you help employees to appreciate that those side effects, that's a good sign. It's working. And I think that's the take-home message. And I really want to reinforce also what Len said. As big employers, it might be important to have a policy that if you really are experiencing, severe side effects, you can't get out of bed, the headache is impossible, doesn't respond to Tylenol. Okay, so you need a day off. I think that's something, again, leaders need to set a good example.
Yeah, there's been a lot of talk about herd immunity, and maybe some truth to it or not. But talk to us about what the goal is in terms of how many people need to get vaccinated before we're kind of on a clear path, and what herd immunity means.
I'm going to let Len go first here.
Thanks.
He's my wingman.
I think it's incredible how the vernacular of the public health community and epidemiologists and infectious disease physicians is now in everybody's vocabulary.
It's amazing.
It's also referred to as community immunity, and I think that's actually a better way of looking at this. Right. When we have a virus or a bacteria, for that matter, that can spread from person to person, if we have enough people in the community who are protected, they can't get infected and they can't spread it. And so the more people we have who are protected, we can protect others in that community if we're not spreading. The level of the percent of people in a community that need to be protected will differ for every particular infectious disease pathogen. It depends on how contagious that pathogen is. In the case of measles, for example, which is highly contagious, it said that one person can spread measles to 16 other people. There we need to have upwards of 90-95% of the community protected through vaccination so it doesn't spread. In the case of COVID-19, it's the infectious reproductive rate, which is referred to as R0, is a bit lower than it is for measles, but it still is highly contagious. And we believe that we're going to need to have something on the order of 60 to 70% of our community protected, in this case through vaccination, so we can spread it. And that's critically important, because to really get this under control, we need to do two things. We need to get a high percentage of our population vaccinated, and that's where all of us come into play. But all of us come into play for another thing as well, which is we still need to make sure that our communities are utilizing social distancing, wearing masks, and washing their hands. Because number one, no vaccine is 100% effective. And also it's going to take a little bit of time to get to that 60-70% of vaccination rates in our community. So the bottom line is we can do this by getting high vaccination rates. It's going to take some time to get there, also because of supply becoming available. So while we're there, we need to continue with mask wearing, social distancing, washing our hands, and that also helps stop the spread. And that's going to be critically important.
So, Kevin, what a great answer from Len. Let me try to emphasize and translate a tiny bit. So that's why this is a team effort, right? To get to 60 to 70% vaccination, that's the team effort. When I get vaccinated, when you get vaccinated, we're helping each other. That is the take-home message. Now, the challenge that we're going to face is in certain communities, most especially communities of color, most especially the Black community here in Philadelphia, as a good example. If they have a 50% vaccination rate, which is what all the surveys are showing, that may not be sufficient to protect everybody. So when I get it and you get it, we're helping each other. And we have to get that message across in the minority community as well. They're going to help each other when they get vaccinated. So even if you're not 100% behind it, you're going to be helping your family and everybody else when you get that vaccine. And I think that's a really important part of the public health, population health perspective that we have to have on the vaccine. And by the way, also that mask wearing, that hand washing, that social distancing, that's going to be with us deep, deep into 2021. So this is not an on-off switch. I think it's really important for folks to appreciate that. I wish it was. That is not the case. So we need layers of protection. It's kind of like Swiss cheese, all the holes lining up. We want to have mitigation. That's our term. Everybody knows that now. So the hand washing, mask wearing, social distancing, and the vaccine, that's a great plan.
Mm-hmm.
Yeah, it's so important because I think in a lot of discussions we're having, the folks on this call with our friends, with our family, with people we know, I think there's a lot of thought that once I get vaccinated, I'm good to go. So obviously communication, we've got 100 folks on this call, which is great, but we have 330 million people in America that aren't getting maybe this kind of detailed information. So the communication effort by whether it be the government or local agencies really needs to be sharing some of that stuff. There's some of the topics you're just mentioning, that it's not an on-off switch, that it might be with us for a while, just to get everyone prepared for it. So what do you know, or what are you hearing about efforts in that field of communication with the population?
So let me take that one first. The best answer, I think, is that it's a typical American answer, Kevin, which is we are going to have 50 governors, 50 ways of looking at this at the very least, and then down to the county level. So Pennsylvania is a great example. We have 67 counties. We have lots of different health officials. Philadelphia County is different from the rest of the state. I'll spare everybody the details, but to answer the question it's going to be a very heterogeneous approach. That's probably the best way to describe it. What I'm hoping is that we'll see some national education. For example, President-elect Biden getting the shot along with Mrs. Biden, leaders, Dr. Fauci getting the shot. He's almost 80 years old, right? It's pretty amazing. I'd like to see him roll up his sleeve on television. And then look, in certain communities, that's not going to be enough. I want to see the Philadelphia 76ers all lined up to get their vaccine. I want to see the Eagles. Maybe they could get something right by getting vaccinated. Sorry about that. But I think we need folks who people look up to. And I didn't invent it, but I think it's a great idea to think about athletes. Take the shot. You get it? Yuck, yuck. Take the shot on goal, the shot for the basket, whatever it is. But take that shot and show that you understand and you're protecting your teammates, right? That's the community thinking. So short answer, we need a lot more public education, and it has to be targeted and specific to certain populations. So there'll be national, state, and local education. We're going to need all of it. We're going to need the Convention and Visitors Bureau education too. Maybe soon we could all get lined up and Len and I will give everybody the vaccine. I think that would be a great day.
At the Pennsylvania Convention Center. Yes, we love it. We love it.
Leading by example is going to be absolutely critical, and all of us leading our own organizations can lead by example. Here in Philadelphia, I read in the news this morning, there's a particular African-American physician who's a surgeon who's been leading a group for education in that community, particularly it started with testing, but now it's about vaccination. And in the news today, she and her husband, who's a first-line responder, a police officer, went to the Department of Health yesterday morning and received their vaccines and did it publicly so that the community,
Great.
that people respect them in that community, so that their leaders were doing this. And so it's also going to be at the level of us as leaders, showing our teams, our organizations, how important this is. It's going to take a village to really make this happen. I'm convinced that we're going to get there. And the more we do, the faster it will happen. And that's going to result in tremendous benefits.
The challenge we might have here, Kevin, is the unequal distribution in these early days of where the vaccine's available. And our clinical colleagues in California who are literally getting crushed. You know, it's a big state, more than 50 million people. That's larger than most countries in Western Europe. So they're going to have a particular challenge. We're lucky here in Philadelphia that we have 5 medical schools and big academic centers who are all prepared and have a plan. So you can't say to all of the attendees, it's going to be perfect every place. It's just not the case. And then we get a snowstorm on top of that, and that hangs up, FedEx and UPS. So look, it's not going to be perfect. We get that. But when it's available and your time is ready, then it's time to get the shot. And I think that's the take-home message.
And to drill down on that point a little bit more, it's fair to say we've got people from California, Texas, New York on this call, and Pennsylvania, obviously. It's fair to say if we're all in phase 3, somebody in California might get it a month or 2 before somebody here in Philadelphia, just based on the distribution and the allocation
Absolutely.
of the vaccine, correct?
Or later than us, right? Yes. I mean, I think it's going to be haphazard a little bit. This is the largest logistic undertaking in world history. I mean, think about that. So it's unbelievable when you have it, that sort of historical context. So we're lucky that we have this amazing infrastructure. The second this thing was approved, out the door from that Pfizer plant, on the trucks, on the planes, Louisville, Kentucky, UPS. I mean, amazing. So, however, it's not going to be even across the whole country. This is a big country. So we're going to have to be patient. That's not easy.
Yeah, absolutely. And we also need to make sure that we're altruistic, because there are certain people who need vaccination before others. So, the sanitation worker needs vaccination before the banker. And
right.
That's an unusual way of looking at things here in the United States and around the world. But that is, I think, when we come through this, we'll all recognize how important it is that we work together to keep all of us healthy. Because without a thriving economy, without a thriving, healthy group of people, nothing else will happen. And so I think it's a great opportunity. And I'm very optimistic that, yes, there'll be bumps along the way, but we're going to be heading in the right direction.
I think Len raises another good point here, Kevin. If you look at an organization, again, like Jefferson, look, the food workers, the custodians, these are essential people. Without that, we wouldn't be able to operate. So it gets us back to where we were as a country in March and April. What does essential mean? And it means without them, things would come to a grinding halt. So we have to be altruistic. We have to have a written plan. It has to have input from all the stakeholders. This is clunky. It's not straightforward. And so essential means exactly that. You want to have food on the table. You want to have heat in your home. You want to have stuff delivered. Well, that means truck drivers, grocery store clerks. I would add teachers. You got to keep the schools open. So we have a collective conversation about what's essential. And every organization is looking in the mirror and doing some self-evaluation to answer that question.
It's almost as though anyone that does not have the capability to work from home is almost essential.
Well, there are a lot of people who are not as privileged as most folks
right.
on this call. That's for
right.
sure, including right. us.
You both know the depth of despair that the not only the country but the hospitality industry has taken on. We've taken on more than twofold the unemployment rate. While some jobs have come back in the travel and restaurant industry, we still are just hammered. And customers on our phone or on our call here, they've had to reduce budgets and lay people off as well, because a lot of them they get a large amount of their revenues and their sources and their funding through holding convention and meetings. Talk to us about what you think maybe that we might look like in terms of bringing small to mid-sized gatherings back into play once things get going, and when and what that might look like. David, we'll let you start.
Okay, well, I don't own a crystal ball, but let me pretend for a moment, and it's a cloudy crystal ball for sure. But I think there are some things we do understand. Look, what I'm thinking about and what I'm telling folks is really we're talking about deep into 2021 before we have big meetings, hundreds of people. Probably the fourth quarter, the last quarter of 2021. So let's call it October, November, December of next year, when most people who want it will have been vaccinated. And to Len's comment, let's hope that's 60 to 70% of the population. So we have this herd immunity. We're still going to wear masks. We're still going to wash hands. We're still going to have social distancing. If we do all of those things, then I think there's an opportunity to think about fourth quarter meetings. And I want to add, with much better testing capabilities that are highly sensitive and specific and rapid turnaround. So let's add it all up, the layers of protection: herd immunity, mask wearing, hand washing, social distancing, and better testing. If we could do all of those things, I'm looking forward to going to meetings in the fourth quarter of 2021.
Absolutely.
What kind of things do you think our meeting planners and organizers will need to do in the future for meetings?
Well, I think they have to bone up a little bit on the science like we're doing here today. They have great people like Len to help, and organizations like the Convention and Visitors Bureau. We're lucky to have this kind of opportunity here in Philadelphia. So I think staying informed, that's a big part of it, and getting additional education. And then reading the recommendations from the CDC. They're going to be keeping up with this and telling the country. I think, speaking personally, finally, we're going to have a lot of scientists and experienced physician leaders who are going to be guiding the CDC, guiding the COVID task force under President-elect Biden. So paying attention to what the task force has to say. And then I think, very importantly, asking employees, well, what do they want? And asking member organizations, are you comfortable? Let's get a survey out there. Let's try to assess people's level of fear. I believe that not every organization wants to get together. I think we have to find out what's on people's minds. What's their comfort level? And then when they come to a great city like ours, we'll be ready. When they're ready, we'll be ready. And we've got great medical care here. We'll have widespread testing. We already have that pretty much in place. We'll have the care available if you need it. We'll have experts like Glenn available to answer questions. So this is what I think potential customers who want to come to Philadelphia will have an array of support systems ready to go. And the sooner they consult with us before coming, the more prepared we'll be able to be.
Yeah, and on top of that, the PHLCVB Health Advisor Committee that Bonnie has formed will be giving, real-time input and feedback into what we can do to keep everybody who comes to Philadelphia safe,
right,
and productive, and listening by doing our own surveys and finding out what our customers want. We'll be able to provide that advice, and we'll adjust accordingly. I think also the way that when I attend the meeting in the future, I'm going to want to make sure that I feel comfortable where I'm going, that the seats aren't so crowded together. There's a bit more space, that there's good traffic flow with people moving through. Testing capabilities for those who want it. Here in Philadelphia, our airport now has a place where you can get testing, rapid testing
Right.
for anybody coming through our airport. So these type of systems in place to make people feel comfortable and also to know that people are listening. And that's a great thing about the group here in Philadelphia. We're here to listen because we want to make sure that we can do this safely for everybody. And we're on our way.
Kevin, so great answer from Len. Let's get even more into the weeds a little bit about potentially fourth quarter 21. That does not mean that I'd be comfortable going to an open buffet. That's not going to happen, not next year. So I still think we have to mind our P's and Q's, separate portions. I want to go to a place that has the certification that they've got better ventilation, they're paying attention to the room cleaning like never before, that the flow of traffic, as Len alluded to. I would want to make sure that any meeting that I went to was following even down to that level of detail deep into next year. I think the time when we're packed tightly in a room and there's standing room only, and the doors are closed and it's hot, that's not going to happen in 21. That's not a meeting I would go to. So paying attention to those details that we've been working on, admittedly, for months, that's going to continue.
I've got to say, a lot of it's going to come back to what we do in terms of educating our clients and what our clients do. And I've got to say, it's been impressive to see what customers in the association corporate space are focusing on. I don't know if I didn't share this in the pre-call we had yesterday, but I attended a conference in Grapevine, Texas in November. And a couple of us on this call did. It was Meeting Professionals International, the World Education Congress. And they stressed the importance, and it was a hybrid event. They had 1,100 people online, and they had 600 people in person. And it was just what you're saying, spread out. They talked every session. The CEO got up at the beginning and spoke, almost shaking his finger at everyone, saying, "We have a duty of care
Right.
to do what's right. If we don't, we will bring our industry and everyone else back. You have to take care of everybody else." They had no mingle zones. They discouraged. They had people walking around saying to please separate yourselves from if you're at the coffee stand. It was really unique, but it was good to see it can be done. And that was without a vaccine. Masks were everywhere, and this was in Texas, so it was important that everyone did the right thing. And I think what I'd heard is there were only 1 or 2 cases that came out of it. One person, or came out of it with COVID. One person arrived with COVID. They sent her home right away, but nothing else came out of it. So, and that's pre-vaccine. So it's good to see that
absolutely
change of behavior, it can be done. And with a vaccine on top of it and continued protocols in place for a while, it can be done. Yep. Talk about travel. Those are meetings and gatherings. When do you think we'll see the wonderful museums and the great restaurants in Philadelphia starting to kind of get back to it? We saw it a little bit in the fall, when things started dropping, they allowed restaurants to open. That's not just Philadelphia, that's New York, that's California, that's everywhere. Once people start getting vaccinated, do you see that starting to ease up a bit as well, going back to maybe in the spring or the summer?
Sure, let's hope so. I think that's the whole conversation we had about herd immunity. You want to eat out, get a vaccine. You want the business to open, get a vaccine. I mean, you want to go to our great museums, get a vaccine. I mean, it'll improve the likelihood that we'll be able to do all those wonderful activities. And folks in Philly remember when we reopened the art museum late in the summer and so on. It was fantastic. You felt like alive again. And then, bad behavior, schools got open, people let their guard down. And then Thanksgiving, exactly as the experts predicted, almost to the day. And look what happened. So we have to continue the education and the commitment. And all the leaders on this call, they play an incredibly important role, as Len and I have been emphasizing. So getting the vaccine and continuing to promote all the mitigation strategies. It's that's a part of what good leadership is all about.
Yeah, and on top of that, I think as leaders, as leaders of our organization, as public health officials, I think we need to continue to educate, to change behaviors in a very positive way. And I think what's going to happen in the future is that if somebody is sick, they shouldn't go to a conference. And we're starting to see that. We're seeing lower rates this year already of influenza. We're seeing lower rates of other respiratory diseases because people are not mingling when they're sick.
Yeah.
So, and I think that's going to be a very positive thing. So I'm very confident and optimistic that come spring, we'll start to see some real changes. It's going to be it's not going to be uniform across the entire United States. It's going to be very dependent upon local epidemiology and what's happening in our communities. But I think with smart behaviors, we have to take personal responsibilities and lead by example. And I'm really very confident that we're going to see some changes come after the.
If you talked about something before, if you want to go to a museum, get vaccinated. If you want to eat in a restaurant, get vaccinated. Talk about proof of vaccination. How do we do that? How do we, if I'm an attendee or an association trying to plan a meeting in late 2021, is there a way to say you have to prove you've been vaccinated? And is that possible?
Boy, this is the question of the hour, and we do not have a nationally agreed upon, uniform, easy to upload app to prove that we've been vaccinated. We do not have such a thing yet. So look, it's not China, where everybody has a QR code on his or her cell phone. We don't have that. So we're going to have to come up with a unique American, way of proving that we've been vaccinated. And it's going to have to be secure, and it's going to have to be timely and adjustable when you get the second shot. So the so-called vaccine passport, or whatever jargon you like, this is going to be complicated. And there are multiple private sector companies, as everybody knows, who want to organize and implement these kinds of systems. But to think that there's one single uniform system anytime soon, regrettably, there is no such thing. So there's going to be some personal responsibility. Large employers can have their own mandate as appropriate, depending on what the work of the people are doing. So it'll be a heterogeneous solution to this challenge.
And maybe just to add one thing on top of what David's saying. So along those lines, as we look as a society to get our communities vaccinated and our members of our organizations vaccinated, we also need to take some other responsibilities about keeping ourselves healthy in general.
Key.
So now's the time, as the COVID vaccines become available over the next few months, to take care of everything else that we need to do to keep our members of our organizations healthy. It shouldn't come as a surprise to all the leaders on this call that many of your members have not gone to the doctor in the last few months, haven't taken care of themselves. Are they concerned? Is it safe to go? But it absolutely is safe to go. And so let's make sure that our members are getting their routine medical care, getting caught up on all the vaccinations that are recommended for adults, for shingles, for influenza, for pertussis, for pneumococcal pneumonia, hepatitis A, hepatitis B, so we can make sure that we're doing everything we possibly can to catch up on what we've sort of missed out on the last couple of months, so that we're as healthy as possible as we move forward, because there are risks beyond COVID in our industry, as we all know. In the travel industry, as people travel, there's lots of opportunities for exposure to all different infectious diseases and to becoming sick in general. So anything we can do to keep ourselves healthy is the time when we're going to have to rely that we're all doing what's best for ourselves, and that helps our community as well.
I want to emphasize that, Kevin. What a great point Len made. And let me bring it down to Jefferson again. We, Jefferson Health, we're open for business, and you are way safer coming to us than you are going to the local mall to do holiday shopping. That's for sure. So getting that flu shot, getting that annual mammogram, getting your medication renewed, seeing your doctor, that is a really important thing to emphasize. And we're open for business in all respects. And like our sister organizations around the country, really, really important. And if you're healthy and you're working toward improving your health, if you do get COVID, you're going to be in a much better situation. That there's no question.
Yeah. So in the world of public health, we refer to this as the toolbox. And I think that
Right.
people are starting to understand what happens in the public health world, because the toolbox is really critically important. It there's a lot of things involved to make our communities healthy. And for me, this is a focus on prevention. I think we're seeing, and this is David's world, the power of prevention. Whatever we can do to keep our members of our organizations as healthy as possible, they're going to have more opportunity to attend meetings, to do business, and to grow their work, expand their networks, and do all the things that take place, including getting to explore our great city in Philadelphia. We have so many things to offer here. And when people come here, we want them to have a safe experience. And part of that is coming because they're healthy. They're taking care of themselves as well when they get here, and then they can fully take advantage of what we have to offer.
A question came through, a great question. If you've had COVID or had the virus, are you immune moving forward? Do you still need to get vaccinated? What's the science saying so far on that?
Sure, I'll take that one. So this is a question that's being looked at right now by the Centers for Disease Control as they're issuing their recommendations on vaccination. And their recommendation is that if you've had COVID in the past, you still should be vaccinated. Now that is in concert to as far as vaccine availability. So if you had COVID last month, you may want to wait another month before you get that vaccine so somebody else who really needs it right now can get it. But if in general, we should be vaccinating people who have had documented evidence of having COVID in the past. But in that situation, every individual needs to speak to their healthcare provider about that. But vaccination is recommended, will be recommended for everybody who wants to be vaccinated, should be vaccinated. And on top of that, there is no expectation, no requirement to test people if they've been infected before they get vaccinated. There's no testing on what's happened in the past involved at all. It's if you want to be vaccinated and the vaccine is available for you based on the recommendations, the vaccine then can be given.
Someone has asked a question, is the 30,000 person clinical trials, is that a typical number for vaccine development or is it lower or higher?
So that is fairly typical, and that's a good question. So I'll give you an example. In the vaccine for shingles, which many people on this call will know about, the vaccine's recommended for people over 50. Those clinical trials also had about 30,000 people enrolled. So that's a fairly typical number that gives us a very good sense of safety in a large number of people, and also allows us to look at the efficacy values as well. So very typical. And what would be expected? We wouldn't expect anything lower than that for the COVID vaccines because no shortcuts have been taken. It's just we've been able to do things more efficiently and more at risk around manufacturing. And here I want to give credit where credit is due. The United States government did a very good job here in taking some of the risk off the table to move these vaccines forward. The risk wasn't around safety. The risk was around manufacturing. Commitments were made to manufacture drug and vaccine that may never have been used. And they just took the financial risk off the table. So those numbers are absolutely what I would expect as a vaccine developer. And that's one of the reasons I feel quite confident in the data.
Hey, Kevin, while we're on this, maybe one of the folks asked about it. Why don't we ask Len about the other vaccines that are in the queue? Because the Pfizer and Moderna, they're the unique mRNA technology, pretty incredible. I mean, we don't have to get into the weeds on that, but there are other types of vaccines coming in very quick succession. Maybe Len could give us a little bit of a preview.
Absolutely, thanks. So the two vaccines that we've all been hearing about right now, the Pfizer vaccine, the Moderna vaccine, exceptional data has come available from these vaccines. It's incredibly reassuring. Those vaccines were first because of the technology that was used. It's a new technology that allowed the vaccines to be manufactured, created faster. And so the faster you could create the vaccine, the faster you could start clinical trials. But once the trials were done, they were the standard trials to collect safety and efficacy data. Those vaccines, these will be the first vaccines that will bring to use using this technology called messenger RNA. The next vaccines that are going to be coming online are the vector technology. And the vector technology also is fast to create the vaccines. It's what we call a platform technology. So it's a technology that's been used and you can just sort of, it's like a chassis of a car. You can just put a different car on top of the chassis. That's what's happening with the vector technology. That technology has been used in the past with Ebola vaccines. The Ebola vaccines that were used in Africa during the Ebola crisis and are now in the US stockpile use the vector technology. Those are vaccines coming from AstraZeneca and a company called Janssen, sometimes referred to as J&J. Then the third level of technologies that's coming a little later is what we call the protein adjuvanted technology. This is the technology that's widely used today in clinical practice. This is the technology for one of the hepatitis B vaccines. It's the technology, actually, it's for all the hepatitis B vaccines. It's the technology for the shingles vaccine in people over 50. It's in one of the influenza vaccines, and it's a technology in the human papillomavirus vaccines and also in the meningococcal serogroup B vaccines. So a tried and true technology. It takes a little while longer to create that vaccine because of the way the proteins are made, and those are coming in the next few months. So it's going to take multiple winners here. We need multiple vaccines because there's 330 million people who live in the United States, 7 billion people who live around the globe.
Right.
We're going to need multiple winners, multiple vaccines. And this is what's going to get us to normal, having vaccine available for everybody who wishes to be vaccinated. And that's why it's not like a switch went on today and we all of a sudden have hundreds of millions of doses, but it will be coming because we'll have multiple vaccines. All of these technologies are targeting the same antigen, that spike protein that we hear about. And all of the technologies will, I'm sure, when they're licensed or authorized by the FDA, they'll all offer the same level of benefit to patients. And so it doesn't really matter when it becomes later on in time which vaccine you get, as long as they're authorized. That's the vaccine that's available. That's the vaccine that you'll get. And it's great to see that there'll be so many options because we need to have so much vaccine available for people all around the world.
Fair to say that the Pfizer Moderna are two doses. Is it true that some of the future ones might only be one dose?
It's possible. It's possible. The vector technology has the potential to be one dose, needs to be proven. And then also there'll be questions about, well, you need to get another dose later off in time. So right now they're 2-dose vaccines, and that's critically important. So when people are getting their first dose of the vaccines now with the Pfizer and the Moderna vaccines, they're given a card. And on that card, it will write down the name of the vaccine and it will say the date. And then when you need to come back and get the second dose. And the Centers for Disease Control has created a really interesting system, which is called vSafe, which is a mobile app program where people can register. They can record what's happening after vaccination so we can collect safety data, but it will also have a patient reminder. So when you enroll in this program, you'll get patient reminders, recall reminders to come back and get your second dose, because that second dose is going to be critically important because that's the full level of protection. So here, I do want to emphasize, it sounds like a lot of information, but rest assured, the healthcare providers, the clinics that will be doing immunization, the pharmacists that will be doing immunization, critically important group of individuals who are tremendous with vaccine and education. They will all be giving the information to you and your members will know exactly what to expect and what to do and when to come back and get that second dose. And I'm very encouraged to see that in the bills that are coming right now in Congress about the next level of financial assistance include increased funding for states and local governments to provide this level of education. So additional resources will be coming that will then go directly to patients so they know exactly how this is going to play out.
So with so many options for vaccines, is one better than the other? I know news came out recently that some side effects in terms of folks with, if you have a high allergy, I think it was the Pfizer might not be the best. How will that play based on people's individual needs and health records?
So the data that are available right now that we're all able to see are for the Pfizer and Moderna vaccines. Today, actually, the FDA is meeting to discuss the Moderna vaccine, and the data look fantastic, just as good as the Pfizer data. And so my evaluation of the two vaccines, because presumably tomorrow we'll have the Moderna vaccine authorized, they're both at the same level of effectiveness, and the safety profiles are very similar. So it doesn't matter which vaccine you'll receive. And if there are differences in the future with the next vaccines that come, we'll discuss that and we'll be able to judge that. But I would assume as a customer right now, as a patient having the opportunity for vaccination, when there are two vaccines available, presumably after this weekend, it doesn't matter which one you get. They're both going to offer the same level of protection. The key is to make sure you get the second dose, And the key is to make sure that you receive that vaccine according to the implementation that the CDC is stating, because we want to make sure that the most vulnerable people, the people who are most at risk, are the first people to get the vaccine. And that's critically important as well.
Kevin, I think Len's raised a lot of important points here. I would add that folks should, if you would, stay tuned. We'll be back. We'll bring more information as soon as it's available. But right now, I think as soon as they approve the second vaccine, whichever one you have access to at an appropriate time, that's the one to take. Absolutely. But we'll be back as the situation merits. And as new vaccines, new technology, old technology get approved, we'll come back and discuss the data and the recommendations for sure.
We'll wrap up with one last question. And that is, it says guidelines for mass gatherings are widely variable. Who should we look to and trust for this guidance?
Well, I think definitely CDC recommendations are probably the top priority as it relates, and the local health authorities, because they're going to know what the prevalence and incidence is at the local level. And look, again, we have folks from all around the country. Our colleagues in California, in certain Midwestern states where the test positivity rate is 20, 30, 40%, that's a very different story than in a town where it might be 10%. So that's a really hard question to answer. I think CDC first, local health authorities second. Here in Philadelphia, I think we're very fortunate that the health department, the mayor's office, they've worked pretty much hand in glove along with the governor. So listening to these folks at the local level, that's going to be very important.
Absolutely.
Len, one last question for you, I guess. With the progress we've seen with the speed to market and the safety still being intact, does this change the world of vaccine development forever? I mean, is this now the new normal where they've been able to prove that it's successful doing it this way with the mRNA, so we can maybe see, because we all know there's going to be another pandemic. We're not done with this. Hopefully it's not for another many, many years, but does this make things better for your world?
This is a truly transformative time, highly disruptive in a very positive way, opportunities here. The technology with mRNA, it's not going to solve everything. It's not a technology for every potential infectious disease, but it does show that with knowledge of human immunology, transformative science, and really creative thinking, and government support, it was a government that was critical to help move things forward, that we can solve problems and do it in novel and innovative ways. So I think the entire biomedical sciences community is really going to be transformed from this process. But the key is, and this is maybe one good way to end here, we need to not lose the opportunity that's coming out of this. If we need to find a silver lining in this pandemic, it's that we see how we can solve problems, but we have a short attention span here in the United States and around the world, and we don't want to lose the focus. We need to rebuild our public health community. We need to continue to train and bring new talent into our industry who can help address these issues. And if we can take this advantage and move it forward, we're going to end up in a much better place. That's for sure.
Well, Kevin, for all of our leaders that are on the phone who pay for health insurance for their members and all the organizations, Len is totally correct. Let's not forget, in calendar year 2019, Americans spent $10,000 per person on health care, and at the same time, $400 per person on public health. $400, $10,000. What gave us a better return on our investment? That's what we have to think about in 2021. And I know I'm personally committed to making sure that we don't go back just to the way things were, and we build a better system for everybody for the future. That is a great holiday wish.
One last vaccine question. Do we have any idea how long it'll last? So again, if we get it tomorrow, well, am I good for a year? Am I good forever? What's the science on that?
Great question.
So the answer is we don't know, but the evidence points that the vaccines are likely to provide some good durability, but time will tell. and this is being followed literally daily on what's happening. Thus far, look pretty good, but we will find out over time. And if we need to give another dose, we'll give another dose. But what's important right now is that we make sure that our society gets vaccinated, that everybody has the opportunity to be patient and allow people who need the vaccine in a higher priority than maybe others. But we can make this happen. And I'm looking forward to later in the year where we can get back to do things safely here in Philadelphia and to continue to grow and thrive. And but let's respect the science, and we'll collect the information for sure. And but everything is looking in a good direction for sure right now.
And remember what we said months ago with many of the same amazing customers from around the country: spread the science, not the virus. That's key.
I like that.
Well, with that, we're wrapping up our time. I want to thank you all. I think it'd be a better thing if we didn't know Dr. David Nash or Dr. Friedland or Dr. Fauci, but unfortunately, we're in this position today. And I want to, I think we need to thank God that we have people like you that are doing the science and helping educate us all, because we've been a whole world of hurt, but you've brought this to our attention. Hopefully we take it and learn from it and embrace it moving forward, and are all better off for it. I also want to thank our almost 100 customers and partners and members for joining us today. We will do our best to get all the questions answered and responded back. And I hope that we can do something maybe in a couple months, maybe in February, kind of recheck another one of these calls to see where we've progressed from that point and what it's looking forward to. And hopefully we'll be inching that timeline back more closer to us in terms of getting back together in the meetings and conventions, because the science has been so good and Americans have been so good at what we're supposed to be doing in terms of being careful. So with that, I'll say happy holidays. You all be safe, wear a mask, and stay apart. All right, everyone, thank you. Happy holidays.
Thanks again.
Take care.